How is everybody? Is Dr. Katka here. Welcome back for our amazing sunset musings. I missed you very much. I hope you had a beautiful holiday weekend. We're back with an amazing sunset. Here we come. Beautiful. These trees just amaze me, you know? Look at that. It's still standing. It looks like a sculpture of a kind. So our saguaros look like they are done blooming. I have an amazing story for you that I have little videos and then I have to put them together into a story. It's going to be posted under the Nature Musings on our channel. And here's what I'm looking for. I'm looking for a Native American tribe that will be harvesting the saguaro fruits. They actually have down in Tucson in the Saguaro National Park, they have the Hohokam tribe comes and harvests the fruits. And it was amazing. I just went to visit for the day. It was just so gorgeous to see. The saguaros are just so majestic, you know. And it's the first time ever there was a fruit low enough that the birds didn't see it yet, that I was able to actually get a taste of the saguaro fruit. Oh my goodness, I had no idea. It's so delicious, sweetest thing. So no wonder the birds just are right on it as soon as they come up. They actually open naturally. Boom, boom. Beautiful. So I have lots of announcements. So I'll be putting this video out. It's really cool. It's a little bit of a journey. Then I have a short, this will be for our community, that's coming out any minute. It is a little bit of a recap of May and what we're up for June, but I'm going to just post it for everyone to enjoy. It's just a brief one, just a little bit of a, you know, with some powerful information there. I'll be posting the video for the nature one for you, so we're in for a lot of treats. And hello everybody. So look at this, we'll have some nice sunset there with the clouds. So today I wanted to share with you just briefly, you know, there's so much happening all around the world and moving into June and all of that. I'm actually going to let me see if I can set this on the ground without me moving. Hang on, that you could actually enjoy the sunset without me making it move all the time for you. Let's see. Oh, this is not bad at all. Not bad at all. Okay, hang in there. I'll make it even better for you. So I have to tell you, there's part of me, and I guess it happens to all humans. There was a part of me, there we go, that I thought, you know what? I don't know, should I keep doing these sunset musings? Should I continue? Do people like it? Do they not? Like, I don't know. And then I had this amazing lady who was helping me out of the office say, you know, I don't always manage to come on time to the live ones, but I always watch them at the end of the day, and they're like my little thing. They're so relaxing. It just calms me down. I feel so good watching the sunset, and I'm like, yes, that's beautiful. Because not all of us get to witness the beautiful sun setting. And so the next best thing we can do is a live one from someplace, just like you enjoying this one right now. And while you do that, we have a few minutes to go. I'm going to scooch here next to you. And I'm going to share with you a couple things that I learned today from my beautiful patients. I am starting to see, here is I'm starting to see, just very briefly, we're not going to go much into COVID anymore, but I'm starting to see a lot more people that are finding about ozone that have post-COVID symptoms that haven't healed ever for like a year, 6 months, and also they're trying to get ivermectin, but their doctor is not open to prescribing it, so they have to be getting the the animal source one, which has no dosage or anything. So if you know anybody who is looking for ivermectin just to have as a prevention or to help with symptoms, send them my way. I'll be happy to do that. And then for anybody who is open to natural treatment, the ozone therapy and the hydrogen peroxide IV. The hydrogen peroxide IV is more for the upper respiratory, so if there's lung issues and upper respiratory sinuses, and then the ozone takes care of the more of an inflammatory, like the loss of smell, loss of taste, the pains and all that. So we have some beautiful treatments that are available for people to feel better pretty fast. We also have that list of supplements if somebody is not local or doesn't want to do the intravenous. There's lots of available, so just let them know. They don't have to just kind of wait. There's a lot that can be done. Okay, so that's a good one. I've seen actually 3 people, and very young ones, that are going to do really well after a couple treatments. And then the other thing that I want to share with you today today's a Wisdom Wednesday. Today is the 2nd of June. It's amazing. More than ever, I see now how important it is to make our own decision when it comes to our medical power of deciding what's best for us. We're being pushed one way or another right now when everybody has to decide, do I vaccinate or not? So that's only one of many decisions, and we have so many more. And we have been so programmed in our world, as doctors really, and as quote-unquote patients, we have been programmed that the doctor knows better, and therefore I shall trust them. And I'll tell you over and over and over that the way out of this is, one, doctors becoming more understanding that is not the case, and having more open mind to what the person needs. Because I was so sad for this person. A new patient wanted to come in and she wanted to use her insurance, so she said, what blood work should I do? And I said, okay, this is the blood work that we need, go, your doctor will prescribe it. So she went to a substitute doctor because her doctor wasn't there, and she shared with me that it was absolutely like a horrifying experience, because this doctor started literally yelling at her what are you thinking? Like, who do you think you are, asking me to prescribe this? You're gonna do the test that I tell you to do. And she was shocked and baffled, and I thought, oh my goodness gracious, like, is this really happening in our world? And so one of the big ways out is for as physicians becoming really more conscious about the patient, quote unquote, as a human being sitting in front of me, knows their history more than anything. I visited with a beautiful lady today, and she has seen so many doctors, one of them for 15 years, a couple other doctors to help, and it's like she knows best. Like, I can tell her what I would suggest, I can tell her what the best treatment is, but ultimately she has been through some ups and downs, sometimes going too fast with treatments, and doctors done a little listening. So I'm like, you are the one who needs to ride this bus. We're all here just to support you, and you're not to make decisions, which treatment. I'll give you the options, and I'll explain to you which, why, and what, and the power of the healing becomes by you being empowered in the midst of the decision and the treatment. So as the sun is setting today, it was just so clear that that is, as I said, the inner empowerment is going to be the way to a deeper healing. Thank you, beautiful day. Thank you, beautiful sun. And thank you for the clouds. That's magical. Wow, this was gorgeous. And the other thing that I have learned that I'll share with you while you are enjoying, hang on a second. My glasses are falling. I can't do that. Wasn't that just awesome? Did you see this? Ha 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 ha. That was beautiful. The other thing that I have learned, and oftentimes that happens in the natural medicine world more, and in like a physical therapy and in the healing arts, more so than in the traditional medical world, that we kind of become part of this cycle for our person, you know, as I'm the healer and somebody, quote unquote, and somebody comes to me to get help. And then when the empowerment and the back and forwards, like I actually empower you to take charge of your health, when that doesn't happen right off the bat, sometimes a relationship can develop that's not fully supportive of either one, the practitioner or the patient or the client, where the client becomes dependent on the decision of the doctor, or there's like this power being given to the practitioner and it's not being sort of balanced, and that can kind of create a loop where the healing is going to take much longer. It's just like the loop kind of has to, in order for their relationship then to keep working, there has to be this imbalance. So oftentimes what happens when one or the other party starts realizing this doesn't work, both of them have to be invited to move to a different level, because if it's just one person, oftentimes it ends in ending the relationship, whether the client decides they don't want to come or the practitioner says, I can't see you anymore. I've seen both. And all that is, it's like an invitation to the next level of healing that's available. And it's just so beautiful. I've witnessed that today a couple times, and it was just so gorgeous. Somebody really understanding that by me doing this from the practitioner level, I am enabling this space that doesn't allow for the healing and the empowerment. And then coming from the other side, the client patient understanding like, okay, I actually have a bigger say-so here, and I don't have to tiptoe around you guys because you're doctors. I can actually have a big say-so in what I need from a place of real empowerment. Yeah, it's just beautiful. So yeah, our medicine has been kind of boxed in a little bit, and we are opening the doors and blasting the box open while we are enjoying this amazing sunset. So happy for you to have visited with us. Hope you had a beautiful, beautiful day. I mean, look at that. And then over here, there's some clouds too. Our beautiful colors. Oh man, thank you. Enjoy for a few seconds. Say your blessings, say your prayers, say your gratitude, whatever it is you do your end of day. And I will see you tomorrow. And thank you so much for visiting. Lots of love. Take care.